I don't know if anyone here has experienced where the patient is so stressed that she's shaking. Have you had that? Okay, very good. I can get rid of that in 30 seconds. You can get rid of that while you work. So you don't have to stop. You don't even have to stop for 30 seconds. You can just start straight away. It's so useful that you can do this even if the patient isn't anxious. You might as well practice. Practice on the non-anxious ones, so that when the anxious ones come in, you've got them under your belt. Isn't it true that when you've worked with a difficult patient, with an anxious patient, and they've got you worked up and all anxious, when you go to your next one, you're still carrying some of that baggage. You've still got some of that emotion. Is that true? Yeah. And as a result of their anxiety, you become anxious. Because you don't want to mess it up now, because if you mess up, it's going to be even worse. Okay? So, they've put you into a trance. Now who's the boss? If your patient gets you into a trance, that's bad news. Okay? Because your state of mind controls how well you work, doesn't it? When you're calm and you're in the flow and you're relaxed and you're focused, don't you do a better job than when you're freaking out? Is that correct? Now imagine you're doing your job, and you know when you're doing your job well. You know when you've fixed the tooth, and you've done a root canal or whatever, you've done it just right. Yeah, you know that. Now, what if you could add to the satisfaction the fact that you've been able not only to control his teeth, but his nervous system and his feelings? Okay, so the satisfaction that it brings to you as a dentist is amazing. Now, a patient, kids can tell this a mile away. Adults can as well, but kids even more. They'll be able to look at someone and they know how far they can push them. Yeah. They know how far they can push it. And adults are exactly the same. A lot of what you've been saying here is, when I asked you how do you calm your patient, that I do the hand technique. Right? If I could chop their hand off for you, I would. Okay, that's the worst thing that you could do, the hand technique. What you're telling them is you're in control, and I'm the bus driver. And just press the stop button whenever you want and I'll let you off. Okay? And some of you will tell me that they go like this, right? Every 2 seconds. And well, why did you give them that? Why did you give, why did you give them that? They're wasting your time, right? I mean, the 5 seconds that it takes for you to get into there and then get back into the zone and focus again. Okay? And then they put their hand up again, you haven't even touched them. Okay? So, you need new ways of dealing with anxiety. Really, I mean, this whole put your hand up thing, stop it. Okay? Gets them off pain. What else? We're going to talk about pain. What is pain? What is it? Because they've got this thing now I was watching, what was it, Scrubs or whatever? We're talking about this archaic method of measuring pain. And it went from 1 to 10 and had a little picture with someone's face. And if it was really scrunched up, it was a number 9. Okay. That's, the majority of people don't know how to assess pain. They don't even know what pain is, right? So, are you feeling pain? Yeah. Oh, okay, well, let me stop. Put your hand up, right? It just, you're going round and round in circles, you're not getting anywhere. So, it allows the patient to get out of pain. That's true. What else? I once saw this really, I mean, it was hilarious. It was really warm and sweet as well, but it cracked me up. This kid was running around in a park, and he fell and grazed his knee quite badly, and he walked up to his dad and he was crying and he just pointed, he didn't say anything, he couldn't speak, he just pointed down. So his dad looked at him, knowingly, and his dad went down to his knee and kissed it, and he looked up and he goes, "Is that right?" The kid goes, "No." So the dad gave him another one, he goes, "Is that right?" The kid goes, "Yeah." Okay, and that was it. There's your local anesthetic for you. And I mean, the kid was crying 2 seconds ago. What changed? The fact that the dad was able to get rid of his anxiety.
They'll be more willing to do other treatments.
They'll be more willing to do other treatment. That's very important.
Not even the treatment that's needed, but
I mean, like aesthetic stuff.
Aesthetic stuff. Okay. Yeah. I mean, I'm not a dentist, but I believe that what you guys do is actually useful for the patient. It would be nice if you guys believe that as well. Yeah. That it's actually useful, and I actually believe that the aesthetic part of dentistry is maybe more useful than just the removal of pain. I honestly do. I'm one of those people that thinks that if you had a woman with pretty teeth and the same woman with bad teeth but tons of makeup on, I think she'd look prettier with nice teeth and no makeup than if she had tons of makeup on her. Yeah, so that's something that what that would then do for her confidence and her job, and career progression, and whatever else. So I actually agree with that. The aesthetics is very, very important. We'll mention that as well later. What else though for the patient? So we mentioned this. It gets rid of the pain, enables them to do other treatment, it makes them happy, less stressful as well.